Welcome to Healthy Pets, Healthy Owners. I'm Dr. Edmund Sulkowski. You know, we have a very serious, important topic today, but I got to tell you right before we started the show today, something that was said that's made me laugh hysterically. So I'm not crying. I was just laughing very hard before the show started. Anyway, we're going to talk today about our oral cavity and the importance of taking care of it in order for us to be healthy. With my guest, my brother, Dr. William Sulkowski. Welcome back to the show, Dr. Bill.
Appreciate it.
You know, well, the oral cavity I know is extremely important, but I'd like you to tell our audience why that is so.
Most of the disease processes that affect people in their older age, things like diabetes, Alzheimer's, arthritis, any inflammatory diseases, have a lot of cause and roots of disease that start in the mouth, and with gum disease and abscesses of the teeth. So people that come into the office that want to remain healthy their whole lives, those are the people that have absence of gum disease, absence of infections in their mouth, and also they're able to chew food that are good for their health so that they age. I call it aging gracefully. And there's numbers of people in my office that are older who I ask them, what do you do? He said, well, I always flossed, I always brushed, I always have my teeth clean. I eat, the vegetables and take my vitamins, antioxidants that help with staying healthy. So there's a common core here, or a common ingredient to aging gracefully, and it is healthy gums, healthy teeth.
Well, we know that there's bacteria, both good and bad, pathogenic and non-pathogenic bacteria, that's important for everything from digestion to our immune system. But what happens when we're not brushing?
Well, you're going to have bleeding. You see these commercials on TV where people are brushing and then they expectorate and they have some bleeding in the sink from brushing their teeth. That's the beginnings of gum disease. But if you really think about it, if you have a cut on your arm or leg and you're walking through, I always use the analogy going through a sewer, and if you have a big cut on your arm, you're getting bacteria constantly in crossing the barrier of your skin into your body, and it's happening episodically. But if you have gum disease, you have multiple infractions of bleeding gums where actually this bacteria that you're talking about will enter the bloodstream, and it happens when you chew. You don't know it's happening because they're micro bleeds often, and it happens when you eat a pretzel that's hard, or bread that's hard, or even meat sometimes that has some fibrous, a little tougher meat, that kind of thing, and you cause these micro bleeds. That's the beginning of gum disease. Now, if gum disease is so bad, I've seen people in my office that you literally touch their gums. I had somebody in the office the other day, they came in with a toothache. It wasn't a toothache, it was the gums were so bad they were hurting. And you touch the gums, they bleed. Just touch them with your finger.
So that's basically walking around with an open wound on your arm or your hand.
It's and somebody coughing on it, and somebody spitting on it, and somebody and you're touching the toilet with it.
And this is going on 24 hours a day when you're
24 hours a day, 365, and it's a cumulative effect that causes these that adds to these degenerative diseases in our maturity. And again, the evidence has, and clinically I see it in my office, the healthiest older people, 70s or 80s, 90s, have healthy gums that do not bleed at all, and no abscesses, and they're able to chew their food good. So we take that for granted. I'm sure a lot of the younger people here, their teeth are healthy, they're not paying attention to that. But as you get older, nutrition becomes even that much more of a factor to staying healthy. And what I mean by staying healthy, stopping the progression of Alzheimer's disease, stopping the progression of diabetes, stopping the progression of other inflammatory diseases, heart disease, that they find that gum disease at its worst form, but gum disease at any level affects these particular disease processes in the body.
Well, those blood vessels are right at the surface, in your mouth more than anywhere in your body, actually. And so it doesn't take a lot for microscopic tear to cause a problem. But we know that oral health care is important. We need to brush and floss. But what happens when we're not doing that? And well, let me ask this question first, Dr. Bill. How many times a day and when should we brush and floss?
Well, it's recommended by the American Dental Association that you floss once a day. And the reason why you floss is you can't brush between the teeth and into the gums with a toothbrush. So that takes care of that particular surface. And you should brush at least once a day. I find that inadequate. I find that the people who have the nicest teeth, because everybody's in a rush, and part of the program and the beauty of this program and the beauty of the fact that Peters actually puts these kind of programs on is to make people aware. And we try to do that in our office on a daily basis, make them aware. We're facilitating, we are coaches. So we show people in a nice way how they're brushing, where they're missing, what they have to do to keep their teeth nice their whole life, and then give them the responsibility to do it. So it's informative, and this program helps that way. So I'm of the opinion when I see people that you ask me how do we keep that from progressing, I think people should be brushing minimally in the morning before they head off to whatever they're doing for the day, and before they go to bed, and flossing those particular times. But the healthiest gums and teeth on people that I see are the people who essentially brush every time they eat.
Is the toothbrush important?
The toothbrush is extremely important. You have different kinds of mechanical toothbrushes. You have the ones that spin, the ones that vibrate, and then the conventional ones that you see all the time. And they should be a soft, multi-tufted bristle so that you don't do any damage to the gums. And it's technique sensitive. You don't want to brush to hurt the gums, but you want to brush enough to get the plaque away from the gums, because most of the problems are around where the gum touches the tooth.
What are these terms, calculus, plaque, tartar?
Well, the plaque would be the soft materials that you have a meal, you don't brush, the saliva mixes in with the food that you ate, and if you don't brush your teeth, it starts to accumulate around the gums, and it's soft. Well, soft plaque you can brush away, or sometimes you'll go to the hygienist. We recommend going to the dentist twice a year, but some people have to come 3 and 4 times a year, and we'll show them, well, you're missing here, you got a little bit of soft plaque. The hard plaque becomes calculus, similar to the residual mineral deposits that you might see around water or your sink or your tap or whatever. It is calcified plaque. So plaque that is soft is plaque. When it gets hard, it becomes calculus. You can brush the soft stuff away, or the hygienist can clean it very easily. The hard stuff you can't get out of there, and that's when the hygienist gets in there. And frankly, you can vibrate that away. It's painless, it's easy, but it keeps your mouth healthy. It doesn't accumulate, because once it starts accumulating, it goes fast.
And then that's what causes the gums to become infected, because it irritates the gums?
It becomes essentially a foreign body, similar to a splinter in your hand, and the body will want to wall it off and try to dissolve it or try to get it out of there. And it becomes a foreign body reaction, and the toxins that are first of all, that's a toxic material.
In other words, there's a biology going on there of microorganisms that are growing and producing waste products and toxins.
If you took that material, put it under a microscope, people would be brushing 24 hours a day if you saw how ugly and how active that material is. And that material creates toxins, and those toxins enter your body through the bleeding gums, and/or gum disease causes, or I don't want to say causes, but it exacerbates lung disease. There's studies out there that when people have gum disease, they aerosol this bacteria and breathe it into their lungs, and exacerbates pneumonia, COPD, and these different lung diseases. So what happens is it's so interrelated. We used to think many years ago, I've been doing this a long time, that, if you keep your gums healthy, you keep your teeth, that's a good thing. But now we're saying you keep your gums healthy, you keep your teeth healthy, you live longer and a healthier life. You do not have these age-related diseases that debilitate you.
Because these organisms migrate to other organs of your body.
Think about this, Dr. Ed, as far as the same blood running through your gums is running through your brain, is running through your heart, is running through your kidneys, is running through your liver. And now here's what I'm going to do on a worst case scenario. I will inject bacteria into an artery. A dose of bacteria, a dose of virus, because the same bacteria that's in your mouth is in your whole digestive tract. It's meant by nature to be in your mouth and in your digestive. It is not meant to be in your blood. So when you have a cut or bleeding gums, you have multiple cuts in your mouth, and that bacteria is titrating into your bloodstream, as you said, Dr. Ed, 24/7, 365. You are always, your body is fighting this bacteria and virus, and it's.
So it lowers your immune system, for one.
Well, now body says I have to fight this, and I don't have a certain amount of energy to fight some of these other things. So what happens is you're creating a problem for your body that shouldn't have to exist. So now your immune system doesn't have the energy to fight the cancers. They're linking gum disease to pancreatic disease. They're linking gum disease to, this is the latest in scientific studies, that they're relating gum disease to pancreatic disease, to liver disease, to kidney disease.
And we've known for years with heart disease, because one of the things that with somebody that has a mitral valve prolapse, for example, you have to do a preventive procedure by prescribing an antibiotic before you do any procedure on them.
This is an interesting paradigm here. In the old days, you had a knee transplant, and that you put people on a prophylactic dose of antibiotic. Now, now the doctors are sending people in for pre-evaluation for their heart valve, for their knee, and we have to clear them of abscesses, clear them of gum problems, and otherwise the result of these may not, you'll get an infection in your knee, or that valve won't work.
So before these surgical procedures are done, they're
getting clearance now. Clearance now, and that was unprecedented. And I always wonder why, they didn't do that, and now they're doing that. And what's happening is people who have had these procedures have to get pre-medicated, because now we're going to clean your teeth, and sometimes when you clean the teeth, you're going to cause a little bit of you're going to go around the gum, and you're going to cause a little bit of irritation, you see. And so we give people antibiotics that have knees and hips and heart valve transplants, so that if the bacteria would inadvertently get into their bloodstream through their mouth, this antibiotic's already in the system to get rid of it before it has a chance to colonate on these areas that have been worked on. So let's reverse engineer that. If you never had a knee or hip or heart valve, but your gums are bleeding, why don't you prevent the gums from bleeding so that you don't have to have an antibiotic,
So home care is important, and the proper technique, the proper brush, flossing, all of that, but you can't remove everything with a toothbrush. This hard calculus that may develop, you have to go in and have a professional cleaning, which is we call prophylaxis. How often do we need to do that?
Well, interesting, Dr. Ed, what you just said. I brush my teeth every time I eat, and I floss, if I'm in the office or at home. I still get a little bit of mouth breathers sometimes, dry mouth. Dry mouth.
Sometimes even medication.
Medicational dry. So you're going to build up quicker than the average person who has saliva that is, that is very flowing, and to wash the teeth out, from this plaque in this food. And so those people need their teeth cleaned every 2 or 3 months. I mean, Edmund, Dr. Ed, people spend how much money getting their hair done, but they won't get their teeth cleaned, and the hair doesn't make you healthy, but the cleaning of your teeth makes you healthy. And And it's mindless to me, and that's where I think the dental community is working at it. And we have some great people in this area and that stress prevention, but the association should be out there telling people, if you want to be healthy, you have to have your teeth clean, you have to brush properly.
Well, I have to tell you, I think dental medicine was the first in preventative medicine. Regular medicine never even talked about prevention very much. It was dental medicine that really took on. We can prevent cavities, we can prevent gum disease, you do this, you get this result. So we get this calculus built up, it has to be professionally clean, so that the hygienist or the dentist that's doing the cleaning actually goes below the gum line a little bit and scrapes that bit that's developed underneath that gum line. What causes the gum line to recede or pull away from the base of the tooth and actually expose some of the root, or develop pockets in the gum? What are those terms?
Well, so pockets, first off, there's a number of reasons why you can get gum recession. One of them is by grinding teeth. And people are keeping their teeth longer because of education, of awareness. So, and they're aging. People are aging, getting older type of thing, and so what happens is you have people who are using their teeth more and they're grinding their teeth, and oftentimes you'll get some recession based on grinding. I think that's normal, so do a lot of other professionals. But when it comes to gum disease, it is not normal to lose the gums around your teeth and lose the bone when it's toxic in nature. And the toxic in nature means that you have calculus and plaque that is exuding toxins, chemicals that actually eat away the bone. And when the bone gets eaten away, the gums get eaten away. And that's where they used to say long of tooth. As you got older, you were long of tooth.
Because you were exposing more root, and where you don't really see root.
And that's not a normal stage of aging. Some recession is because you use your teeth. I mean, let's face it, you use teeth, a crown's going to wear out, a filling's going to wear out. You're going to have some of these fixed up over time. It's not forever because you're using these things. You know what I mean? You're using teeth at a great rate, a great amount of action. So you're going to have wear. There's going to be wear and tear, but you can prevent problems with that you can control with the brushing and the flossing. Get rid of these accumulations that build up toxins that literally it's like an acid eating into any material, and what it does is decalcify the root. That's where you get the cavities. And the toxins actually eat away at the bone, demineralize the bone, and the bone recedes. When the bone recedes, the gum recedes, even though it's puffy, and that's where tooth loss comes.
So the bone's holding that spongy soft bone that we have, not necessarily the jaw bone, but there's a spongy layer of soft bone. That's what helps hold that tooth in.
And it's God made it such that it's a softer bone, so the teeth actually move in it, and it's a dynamic. And there is no, it's a beautiful thing, but it also subjects it to the possibility of erosion of the bone from gum disease, because it is not this hard bone that's like the arm bone or the jaw bone or the knee bone,
Last night, I was talking to a family friend of ours who's 85 years old, and she was telling me that she hadn't been to the dentist for a while, and she was diagnosed with gum disease, and she didn't understand why, because she never saw any blood, but the dentist said she was bleeding, and that she had to go back for 3 procedures, and she's going to do all this, and she was whining about it, and I started to explain all this to her. So this happens when you don't see your dentist, because you're not able to keep that oral cavity in its optimal health on your own.
Here's the interesting thing. Some people, they'll walk into the office, you'll take a visual look at their teeth, and you'll say, oh, they look pretty good there. You take and then you have to follow up with, have digital x-rays that are high resolution x-rays that you can look on a TV screen to see them, so that, you can really diagnose very easily and very well, high tech, and then you see bone loss. You see the gums way up here and the bone way down here, then you see why, because there's a bunch of stuff stuck in the gums, that shows up on the x-ray. And then you say, wow. And these are younger people too. And some of it's smoking, some of it's
does smoking really impact the oral cavity a lot?
100%, because, well, besides what it does is, there's a dynamic going on. Your body has to detoxify of the smoke. So it depletes your body of antioxidants, and antioxidants are what fights normal gum disease. So if you're overloading yourself with smoking cigarettes, then what you're depleting your ability to have your immune system help with your teeth gum. Having said all that, there's plenty of people who smoke who don't have gum disease because they're coming to the dentist every 2 or 3 months, brushing the heck out of their teeth. We talk to them about it, but their gums and teeth are healthy once they're corrected.
Because they're taking the proper procedures
and I can't
measures.
tell you, I've had people come into my office, I don't want to say how many years ago, but a few decades, more than a few decades, who have gone and said, you need all your teeth out. You have gum disease. I said, well, you can do that, but why don't you go to a periodontist, get your gums healthy, worked on.
That's a gum specialist.
Periodontal specialist treats the gums, and then let's talk about having your teeth clean. We'll show you how to brush better. We'll show you how to take care of them. And cost-wise, first off, you'll have your teeth at the end of the day, and it won't spend any more money. But by the time you pull all your teeth to get a denture, and all this other dentures
or implants,
and then dentures works, but they're not like your teeth. They still have their teeth 30 years later or more, and their teeth are healthy because they followed the protocol. So, and then you have to check with this probe. Now, nobody likes that, but there's a calibrated probe in millimeters. So the gum fits around your tooth like a collar here. So if it's 1 to 2 or 3 millimeters, it's normal, and you can brush the plaque away. But if it gets to be very deep, you can't get a brush in there. So what happens is that stuff, plaque, festers, becomes calculus, and then the disease process is out of your control. It's out of when it's 1 to 3 millimeters pockets, plaque, it's in your control. When it gets 4 and 5, it gets to be out of your control.
What's the biggest cause of tooth loss?
It is gum disease. The biggest,
not cavities like they used to be.
50% of the people in this country have some form of gum disease. When you're 65 years old, it's 70% of the people have gum disease. So now it's a preventable disease. You said earlier, you referenced the fact that medicine, they're getting more preventative too, by the way. But dentistry, is light years ahead of the game. You're in total control. If you want to keep your teeth the rest of your life, you are in total control of it. The dentist is a facilitator and a mentor and a coach and a teacher, and they're going to help you. But if you are, and it's really fascinating because the most interesting people I have in my office are people who are older, because they see the results, they're in control of this, and they want to make sure they succeed.
Well,
and we help them succeed.
We know we rebuild because we supply our body with nutrients. If you can't chew your food, so that food is broken down initially and starting the process in your mouth and then going through your stomach and intestines and all of that, you end up having health problems because you're not able to use the nutrition that you're trying to provide.
Well, that's a whole nother subject material, because what happens is people will default. If I can't eat what's the stuff that's good for us? We all learn about it. We all know about it, the vegetables and things like that. And but if you can't chew a lettuce or an apple or a carrot or broccoli or cauliflower or all these cruciferous and you can't, what happens? You stop eating that stuff. You default to something you can eat because this is missing, that's missing, or you don't have things there to chew with. And nutritionally, you become devoid of these nutrients. And over the long time, the lack of these nutrients cause an overload in your body. You see, you're either going to have people are going to die of lack of nutrients, or they're going to die of overload of toxins.
And
you know what I mean? Overload of of toxins, and those are the two things. Because as long as you're healthy, you're fighting the possibility that you get these diseases. But if your nutrient level is not up from not eating properly, then you get overwhelmed by the disease process, and then that's when you expire.
I think all diseases have their beginnings in the lack of proper nutrition. So the body needs nutrition in order to live. Minerals, vitamins,
that's well
proteins.
Said. That's well said. And if you're not eating properly, so you have, teeth in the front are meant to bite into an apple. Teeth in the back are meant to grind. And so if you don't have back teeth, who's doing the grinding? Your stomach, and then you're having stomach problems. And then you're having digestive problems. And it's cumulative.
And time flies pretty quickly, so these things develop fast. We're just about at the end of the show, Dr. Bill. Tell the audience where your office is.
I'm a practicing dentist in Canonsburg, and we've been there numbers of years. In fact, with all the Sulkowskis that have been a dentist there, it goes about 100 years, because I had an uncle that practiced there for 50 or 60 years, and yourself, you have been there, and myself, and so we have a huge presence and have been there, and we have, we've helped a lot of people. I have multi-generational people who, I got to tell you something, I believe, and they tell me this, that their lives are improved because they can take off gum disease and cavities, and their teeth are nice forever.
And they're not afraid to smile.
And they're not afraid to smile.
Are you taking new patients, by the way?
We are on a selective level, but a lot of times we're getting referrals, and we do. You have to have the right person that really wants to help themselves, and not want to just have somebody else take the responsibility for themselves, and then we will take them.
How often should I have an X-ray of my mouth? And we have about 20 seconds to answer that.
X-ray it's one of those things where you should have them for diagnostic reasons, and we try to extend it as long as you can, but the current recommendations are a full X-ray every 5 to 6 years, and a bite wing to check for cavities, and bone level every 18 months.
Dr. Bill, I want to thank you so much for taking time out of your schedule to come on Healthy Pets, Healthy Owners and talking about this important topic. You can tune in to Dr. Bill here. He's going to be on one of my upcoming shows on my radio show on AM 1250, The Answer, Healthy Pets, Healthy People. That's Saturday morning at 9 o'clock in the morning in a live show. Remember, a healthy pet is a happy pet. When you're healthy, you're happy as well. We'll talk to you next time. Bye-bye. Thanks, Dr. Bill.
That was really good.